Hello everyone. Welcome to Team 3's final project. Our topic is on legal issues with HIPAA laws governing electronic records. Electronic records have many advantages and disadvantages along with laws that govern them. HIPAA plays a major role in their existence. It is important that these laws are reviewed to reflect patient privacy and security of patient information. These electronic records allow providers to use information effectively to improve the quality and efficiency of care. According to Department of Health and Human Services, these records will have little impact of privacy protections or security safeguards that apply to a patient's health information. These advantages and disadvantages include risks and challenges, recent violations or penalties, security measures for prevention of data breach, and impact on various parties. Electronic medical records are becoming more common, and between 2008 and 2011, there was a 17 to 34% increase in the usage of EMR. The Health Information Portability and Accountability Act of 1996, which is the HIPAA, they protect patient privacy and security of individuals' health information. There are two types of electronic records, and both are protected by HIPAA. Electronic medical records, which is EMR, and electronic health records, which is EHR. They are used interchangeably, but the Office of the National Coordinator for Health Information Technology, which is the ONC, uses them exclusively. The EMR came along before the EHR, where early EMRs were medical, used mostly by physicians for diagnosis and treatment. On the other hand, EHRs relate to overall health or general condition of the body and can be interpreted as being sound in body, mind, or spirit and free from physical disease or pain. Health covers more territory than medical and can explain why EHRs go a lot further than EMRs. What is an EMR? EMR stands for Electronic Medical Records. An EMR is a single-practiced digital version of a patient's chart. The EMR contains the patient's medical history, diagnosis and treatments by a particular physician, nurse practitioner, specialist, dentist, surgeon, or clinic. EMRs have some advantages over paper records and can include better data tracking over time, timely reminders for patient screening, and preventive checkups, and they can lead to improved patient care. What is an EHR? EHR stands for Electronic Health Records. And electronic health records are electronic versions of the paper charts in your doctor's or other healthcare provider's office. An EHR may include your medical history, notes, and other information about your health, including your symptoms, diagnosis, medications, lab results, vital signs, immunizations, and reports from diagnostic tests such as X-rays at a provider's office. EHRs can be shared with other practice if the systems talk to one another. Risks and challenges of electronic records. The application of electronic medical record in the healthcare facilities is associated with many risks and challenges. One of the major risks associated with implementation of EMR are security and privacy. When considering implementation of electronic medical records, the privacy of the patient and security of the information is the most important barrier to consider. Confidentiality and security of protected health information, which is included in a patient's electronic health record, is also addressed in the HIPAA laws. The three pillars to securing protected health information outlined by HIPAA are administrative safeguards, physical safeguards, and technical safeguards. These three pillars are also known as the three security safeguard themes for healthcare. The theme covers techniques regarding the location of computers and usage of firewall software to protect health information. The HITECH Act of 2009, which is the Health Information Technology for Economic and Clinical Health, is legislation created to stimulate the adoption of EMR and supporting technology in the United States. HITECH Act was implemented to stress the importance of data breach and protocols to follow when reporting data breaches. What is a data breach? It occurs when a cyber criminal successfully infiltrates a data source and extracts sensitive information. This can occur by either physically accessing a computer or bypassing network security remotely. The latter is more common for larger organizations. Data breach can result in loss of millions, even billions of private records and sensitive data, affecting not just the breached organization, but also everyone whose personal information may have been stolen. So it is imperative to consider security and privacy before implementing electronic records. Another major challenge to consider when implementing EMR is cost. The adoption of EMR is costly. Implementation costs vary according to context and type of software used. The adoption of the EMR places a significant financial burden on both the practice and healthcare providers. A study conducted found that a typical multi-physician practice would spend about $162,000 to implement an EMR, with $85,000 for the first-year maintenance costs. The average cost of a hospital EMR would be significantly higher. The EMR is costly for practices, particularly for the private practices that do not typically possess same resources as the larger healthcare facilities. The providers not only have to buy an EMR software, but they also have to recruit or hire experienced information technology staff for support and training. Additionally, the training and the learning schedule connected with the implementation of EMRs demands substantial time from the nurses and physician, thus limiting the contact time with the patients. The EMRs can also experience the problem of lack of interoperability between systems. In the healthcare industry, interoperability is the ability of different information systems and software applications to communicate and exchange data and use the information exchanged. To have an explicit view of the patient's medical history, it is significant that the systems are in a position to communicate effectively with each other. Lack of interoperability was considered as one of the largest risks associated with paper record keeping. However, the EMR sometimes lose communication of the valuable information regarding the patient's medical history. The lack of interoperability among the systems can result in the loss of patients' past medical data. Thus, it may compromise the quality of the healthcare for the patient. Physician burnout. The study shows that EMR results in physician burnout due to tiresome user interface. Burnout leads to decrease in patient safety, lower consumer utility, and higher chances of malpractice claims, and can affect the workplace for team members. A physician spends a substantial amount of time for clerical type data entry, leading to less time interacting with the patients. Therefore, EMR results in lower job satisfaction, increased stress, and decreased quality of patient care. It seems like not a day goes by where we're not alerted in the news about some significant data breach. The government, healthcare, and banking sectors seem especially impacted by this phenomenon. Electronic records are particularly susceptible given they are a rich source of data. According to Health IT Security, cyber attacks aimed at compromising a person's credentials saw a 70% increase during 2018. The same article notes that this is a dangerous trend given the serious ramifications of a successful credential compromise attack. This is of particular concern given that multiple services often sit behind a single password. The 2018 Department of Health and Human Services data identified 133 reported breaches involving hacking IT incident and impacting around 7.8 million individuals. Another health IT security article noted that 15 million patient records were breached during the 503 healthcare data breaches in 2018. Most breaches involve human error or lack of appropriate checks and balances to manage digital activities. The next slide is a table. The table shows 2018 top HIPAA fines or settlements resulting from the enforcement activities of the Department of Health and Human Services Office for Civil Rights. 2018 was a record breaker in terms of the total penalty amounts paid. There are consistent themes related to problems with encryption, lack of policies, and proper risk analysis. So if you look at this table, you will notice that in 2018, Anthem paid the most fine or settlement, which is around $16 million. The next slide shows a graph. According to the HIPAA Journal, 2018 saw the largest ever HIPAA settlement agreed with OCR. In October 2018, Anthem settled its HIPAA violation case with OCR for $16 million. The massive fine was due to the extent of HIPAA violations discovered by OCR and the scale of its 2015 data breach, which saw the protected health information of around 78 million plan members stolen by hackers. So if you look at this graph, you will notice that through the years, there has been a clear trend toward increasing HIPAA fines. Data breach prevention. All patient information is considered private and must be protected from being stolen and seen by the wrong individuals. Therefore, security measures must be in place in order to prevent data breaches. The type of security used to protect private information varies from company to company. A good security system to prevent a data breach should at a minimum contain some type of an audit system and reliable equipment. Enabling the use of auditors can allow a company to see where their security and firewall is vulnerable before the patient health information is taken and the company, hospital, or individual is the victim of a data breach. Quality equipment and firewall will allow for better protection measures to be utilized. The use of equipment that is of low cost in order to benefit the company financially will only have a short-term benefit, as the equipment may have a higher chance of being vulnerable to a data breach. This can cause an entryway for hackers to obtain patient information. Additional ways that a data breach can be prevented are: train staff to spot the warning signs, keep data on a need-to-know basis, patch promptly, encrypt sensitive data, and use two-factor authentication. Finally, all hospitals and companies using EMR should have a disaster recovery plan in the event that there is a data breach. Data breaches are covered in the Connecticut General Statute 36A 701B. That states, anyone who conducts business in Connecticut and who, in the ordinary course of business, owns, licenses, or maintains computerized data that includes personal information is required to disclose a security breach to state residents whose personal information is believed to have been compromised. Notice to consumers must be made without unreasonable delay, but not later than 90 days from discovery of the breach. Impact on various parties. Patient care has also been hampered. Healthcare providers can't freely share patient information between providers. Each and every patient and client must relinquish permission to share his or her information. The inability to share information between providers takes more time to obtain critical information and affects patient care. HIPAA also gives the patient the right to receive a copy of health information that has been created by a healthcare organization. The Act enforced this to allow patients the ability to become a more active member in their own healthcare. Patients are also now able to share information with other healthcare organizations. For example, research organizations in order to provide assistance in studies that may help the community as a whole. Healthcare research has been severely impacted as well. Researchers within a healthcare organization cannot freely conduct studies based on patients' chart data unless the patient gives permission. The lack of research has significantly raised the cost of recruitment and survey. Costs have also risen because of how complex the implementation of these provisions have been. Healthcare organizations have had to regularly bring in consultants to ensure that all provisions of the Act are covered. Organizations are required to provide training and certificates of training for the employees. Recommendations. Data breaches present themselves in many ways. It may be a malicious activity seeking to exploit the weakness of a system, or employees exposing data by not following established protocols. Either way, the results are the same. Health records are placed at risk. There are several steps which may be taken to protect electronic healthcare data. They are network data encryption, staff education, physical safeguards, and vet third-party suppliers. While at this time, most data breaches relate to email, phishing, and network issues, there are other areas of potential exposure such as mobile and medical devices, which should be monitored as well. Mobile and medical devices present additional risks to electronic medical records. More specifically, we recommend that healthcare providers and companies have clear personal health data management and encryption policies, and that the policies extend to mobile devices. Tools for auditing and honest self-assessment should be developed and implemented to help individuals evaluate the risk to the information being kept or exchanged. There must be clear guidance delineating the appropriate uses, such as personal versus business, of devices which contain health data. Since mobile devices are generally carried with the person, additional guidelines regarding appropriate storage and security should also be provided. Many of us walk around with what amounts to a piece of our electronic medical record at hand without giving it much thought. Technology allows us to wirelessly transmit blood sugars, heart rate, and respiratory rate straight into our doctor's office. However, this great convenience also raises some questions. Who owns the health data gathered by the device? How is the data kept? Are the networks being used by the sender and the receiver secured? As technology evolves, these areas will need to be given major consideration by those intending to keep medical records safe. All people with access to EHR and other patient health information need to practice a questioning attitude when accessing the information. A data breach can occur after a simple event such as checking a patient's EHR over an unsecured Wi-Fi network. A person should be vigilant when checking emails on computers that have access to EMRs. Simply clicking on a link can allow a hacker to access private information on patients, employees, physicians, and other potential victims. This is the end of our presentation. Team 3 would like to thank everyone for listening to our final project, Legal Issues with HIPAA Laws Governing Electronic Records. Hope you all enjoyed the presentation. Thank you.